Katy called me one day and said, I went to the doctor to see if I could get my wisdom teeth out, Mom, and my blood pressure is very high and they won't do it. I didn't know what to do at that point. I called her pediatric cardiologist. He immediately gave her something to control the blood pressure, and we started a search again for surgeons. She said to me, Mom, why is this happening? There's nothing wrong with me. Why am I having to go through all of this?
When I was 3, I was diagnosed with middle aortic syndrome. Living my life, like I didn't notice it walking down the street or anything.
Her cardiologist did a search across the U.S. and we found Dr. Messina. He was the only doctor that we found that had some familiarity with what to do. The first surgery went well. Dr. Messina told us that the graft would probably need to be replaced at the age of 12 to 14. Even from her first surgery to this surgery, she had no limitations at all. So she just felt like a normal child.
Dr. Messina was originally at UCSF when I was 3, so when we contacted Dr. Messina again, he knew right away and was really confident and knew exactly what needed to be done. And it did last me 18 years when it wasn't really supposed to last me that long, and so we really trusted him to do the procedure again.
The second surgery went as well as the first. They were very aware that we would be traveling a long distance and knew that that would be difficult for us because we'd be away from our family. So they scheduled conference calls with us to help prepare us. They put together a team, and I just felt like I never had to worry about Katy's care. I was very aware and very comfortable, especially being away from family and home.
The process of recovering in the hospital was actually a lot easier than I thought it would be. At UMass Memorial, I feel like they really care about their patients. They really took into account my feelings, my pain, like before, after, during. It was just very smooth and very stress-free.
The first time we went through it, it was a lot more difficult. I felt like I had to be there with Katy more and kind of advocate for her more. This time, I just felt like everybody was so accommodating that it was a lot less stressful for me. So it's a huge relief for me to know that she's now received repair and won't go through this again, and she's fine. He's a lifesaver for her.
It's kind of been over my head my whole life about getting it done, and now that it's over, I get to just keep doing the things that I want to do every day.